Bismillahirrahmanirrahim. Assalamu alaikum, everyone. This is Dr. Sundas, and here we are with our new free session regarding the consultation station um, with the reference to the guidance to AIDS MRCP PACES. We have an active participant today, and I think she's here. Dr. Zahir is here with us. So, just to give an idea or introduction regarding the consultation station, as we are doing it on this platform first time. So, actually, this station is somewhat of 20 minutes, which will be divided into two sections. 5 minutes for Viva, and 15 minutes will be given to you for complete history, relevant examination, and dealing the concerns of the patient. So importantly, these three steps should be done and completed within the time frame of 15 minutes. The most important thing that I want to mention is managing the concerns as much as possible. So you need to keep at least 2 to 2.5 minutes to listen to the concerns and manage it in a simple layman terms. You cannot use any jargons, or you cannot give any wrong information regarding the case to the surrogate or to the patient, right? So always, you will always be given a time frame of 5 minutes before the consultation station. That's the resting phase. And at that time, you can read the scenario, you can write down the important stuff written in the scenario, which could be the clues regarding the scenario hidden inside. So, for example, um, in the scenario, it's written that Mr. ABC is 30 years old. So you need to write down the name of the patient, the age of the patient, any comorbid condition or any previous condition given in this scenario, and then what are the complaints? What are the presenting complaints of the patient, and from where this patient has been referred to you, from the GP or from some medicine unit, or from he has reached to you in the ER or where, right? Because it it will show that what type of scenario is it. Okay, it will give you a clue. Everything is a clue. Then uh, sometimes there are vitals given for the patient, and sometimes some labs are also mentioned in the written scenario. So always write down the important stuff on your paper. Do not write much, but write down the important points. Okay, and always in the pointer form, because otherwise you cannot be able to check the checklist. After that, I mean, if you read the scenario in 1.5 minutes, it's done. After that, you should be able to have some differential diagnosis in your mind. For example, patient has presented to you with headache, and she is a young female. Now, write down the headaches, differential diagnosis of headache, primary headache or secondary headache. It's just an example, okay? Then in primary headache, I need to rule out migraine, cluster headache, tension type headache. In secondary headache, I need to rule out any CVST or space occupying lesion, or the history of idiopathic intracranial hypertension. So whatever comes into your mind, you should write down in the points, right? After that, from that, from that presenting complaint, you should write down in the checklist that I need to take intro, I need to do intro section, greeting section, then I will do OD para of each complaint, and then I will do, for example, I will ask about the associated symptoms live. Uh, with headache, you can imagine what could be the associated symptoms: altered level of consciousness, any fits, right? Any unconsciousness, any fits, any weakness of any part of the body, any visual problems, any problem with hearing or swallowing or speech, right? So, relevant history should be asked in a systematic way. After that, you will write down in the chat box that I will ask for, or I will screen for CVS, I will screen for chest, I will screen for GI, right? And then I will ask about the social history of the patient, the smoking, driving, profession, the activities of daily living, the impact of, it's very important to ask about the impact of these symptoms on the patient's life, because at that point you need to show some empathy and sympathy, and that has got the separate marks. Okay. And in the same way, you can, manage the concerns as well. Okay. And of course, other than this, you need to ask about any addiction, any family history, and other significant history that is related to the typical scenario. After that, after taking the history, for example, you have given 8 minutes to the history, no problem. Then you will stand up, you will do examination of the patient relevant to the condition, and then um, you again sit down. And after that, you will ask about concerns of the patient. You need to deal with it in a very empathic tone, and you need to show some empathy, sympathy. You are not robots. We are humans, and we are dealing with the humans in front of us, right? So talk to them in the same way. Your tone can vary. Your some of the expressions can vary, right? You can give a pause if you are breaking some bad news to the patient. So it's like that. And after that, of course, the examiner will give you an alarm that 2 minutes are left. So you can compile your history examination and all that. You can summarize that if you have time. And then you will move towards a Viva. Believe me, Viva will be very simple. I mean, they don't ask you they don't even expect you to have some advanced knowledge regarding the condition. Because what they think is that you are going to be the part of the residency program in their system, because after MRCP PACES, you will be the part of residency exam in the actual scenario. But what we think about PACES is that, okay, now at the level of PACES, we should give answers like a consultant of medicine or professor of medicine. It's not like that. It's a simple, straightforward exam, and that needs your basic skills to be correct, right? So just focus on your skills of communication, on your skills of history taking, on examination. Examination should be smooth, painless, harmless for the patient, and it should be relevant, right? And you should perform in a very correct way. And then the way you explain the disease or things to the patient without giving any false information. This is a major part. Okay. And then for the Viva part of a thing, you just need the systematic approach and nothing else. I hope that all of you that are appearing in PACES exam have somewhat basic knowledge regarding all the diseases, all the common scenarios that usually appear in exams. So you don't need basically to work more on the Viva's theoretical part. But yes, you need to work on your presentation skills, how you present your case to the examiner, and how you present your answers of the Viva to the examiner. Okay. I hope my voice is very much clear and screen is audible as well. If there is any issue, you can write down in the chat box. So nobody is allowed to unmute, please, because I don't want any chaos in between the recording. And if you have anything to discuss or you want to write down anything, you can in the chat box only. Now, Dr. Zahir is here. I think, Dr. Zahir, are you here?
Assalamu alaikum.
Walaikum salam. Dr. Zaid, please keep your mic close to you so that we can hear you in a good way.
Okay.
No, it's quite low. Your voice is low.
Is my voice audible now?
Yes, I think it's audible to me. Can somebody write down in the chat box, is it audible to everyone? Quickly, anyone? Yes, okay. So let's start. Are you ready?
Yes.
Okay. So Dr. Zaid, best of luck. I know you are at the beginner level, and but I'm really thankful to you for your active participation as on the volunteer basis. And I hope that inshallah you'll do a good job in this. And other than this, be relaxed. We all are in learning phase, and you know corrections will be made, of course, from your side, from other side, or from my side. Okay. So don't
Okay.
worry, and just give your best. Okay. So this is a
Okay.
case. You need to write down the important stuff on your paper. I'm giving you 3 minutes, although in exam you'll be provided with 5 minutes. But there are 3 minutes for you, and then we'll start the consultation station. Okay.
Okay.
Okay. Time start now. Okay. Start, please.
Hi, I am Dr. Zahi, one of the doctor in this unit. and I am here to facilitate you. Am I talking to Miss Mary? Uh,
Yes, hello.
are you
Hello,
Miss Mary?
doctor. Yes, hello, doctor. Yes, I'm married, doctor.
Okay. Mary, you are 30-year-old female with complaint of persistent hand pain. I read this from your note. Is this correct?
Yes, doctor, you are right. Yes, doctor, you are right.
Okay. Uh, okay. You are suffering from this pain from 3 months. The difficult time for you as you are facing pain in the hand for 3 months.
Yes,
Is there any
doctor.
other complaint besides this hand pain? Yes.
Well,
What other
doctor,
complaints do you have?
no, no, doctor, no. Yes, I'm 30 years old and I have this hand pain for last 3 months. I was all right 3 months back, and but I don't know from where and how this happened. But this started for the last 3 months, and it's unbearable for me right now. I'm in so much pain.
Okay. Okay, Miss Mary, I will try my best to facilitate you and will help you in this regard. And uh, I can ask, maybe I ask some questions regarding further questions regarding this complaint.
Yes, sure, doctor. Sure.
Okay, okay. Do you have hand pain in both of your
Yes,
hands?
doctor. I have this pain in both of my hands.
Uh, in onset?
Sorry.
The onset was gradual or sudden?
Okay.
When it started
You,
3 months
you
back?
should ask, Doctor Zaid, you should ask like that. How did it start? How did it start? Like sudden or gradual?
Okay.
So, so yes, doctor. It was gradual.
Gradual in onset, and it remains all the time, or it's occur particular time of the day?
Yes, doctor. Actually, it remains all the time, but it is more in the morning, and it is actually worse in the morning. That I'm
Yes.
unable to do my daily routine activities.
Okay. And your daily activities are actually impaired because of this. And
Yes, doctor. It's very much impaired.
okay. So in the hands, are you able to identify in which part of the hands you are facing more pain?
Okay, you can
Are
actually
it's in
ask.
the
Yes, you
joints
can actually
or?
ask Dr. Zahir that can you show me the points? Can you touch those points which are painful? Okay, because it's a long case, so you
Okay.
can ask the patient to show
Yes.
you the exact one. Yes, doctor, I can show you like here. Now she's showing some of the small joints that are actually somewhat swollen as well and tender.
Okay. Do you feel do you feel the redness? Do you appreciate any redness and swelling in the joint
Yes, doctor.
from
Yes,
the
as you
start?
can see. Yes, yes, doctor. As you can see, there's redness and swelling as well.
Hello.
Yes, doctor. There is redness and swelling as well.
Okay. Besides the redness, and is there any deformity or change in the shape of your hands with this
Yes, doctor. I'm feeling right now that my hand shape is changed.
in both of your hands?
Yes.
Okay. Besides it, do you feel any sort of numbness or paresthesias in tingling in your hands?
Yes, doctor. You are very right because I'm feeling some numbness in my right hand, especially when
Okay.
I'm sleeping.
Okay, and sleeping, you feel this pain. Okay, it's also very uh, difficult point. Besides this, is there any other thing that you want to say about this joint pain?
No, doctor, this is it. I think it's very painful for me. That's it. I don't want to remain in this pain, you know?
Okay.
Uh, yeah,
Okay. Besides this, is there any difficulty in any other joint of your body, like in elbows or
not
shoulder or
actually.
knees? And
No, no,
okay,
doctor, not
are
right
you
now.
right now you are not facing. That's
Hmm.
good. And besides that, do you have any difficulty in raising your hands above the head, or
No,
any sort
no,
of headache, any symptoms related to your eyes, or any
no,
sores in the mouth, or
no,
any history of the skin rashes or any allergy to the sunlight?
no,
Do you are you facing some issues related to chest, like cough or sputum, this sort of thing? Are you facing this sort of thing?
no,
Any difficulty in breathing, or any tummy pain, or any thing,
no,
any difficulty? And any do you appreciate any change in the shape of your feet, or any problem in the fingers and the toes of your feet? Any pain in the
no,
feet?
doctor. No.
Okay. So it's still it is all only in your hands. That's good.
Yes, doctor.
Uh,
Yes.
okay. Besides that, and do you feel any stiffness in the morning?
Yes, doctor. This is a good point because I have noticed this strange thing
Hmm.
that while having some rest, I feel
Mm.
stiff. I feel like I cannot move my fingers. And this is very strange for me. I mean, people do
Okay. Till
better.
that time, you
When,
will be able.
please, Dr. Zahir,
Okay.
whenever the patient is talking, do not interrupt. Okay. So,
Okay.
yes,
Okay.
she's telling you that she's feeling very weird, that the
Mm.
stiffness is there, and this is typically after rest and in the morning. Now continue.
Okay. Okay. Um, and till that time, this stiffness remain, or it resolve afterwards. Till that time, for about an hour
Okay.
or more. Hmm.
Yeah, yeah, doctor, it persists around half an hour or more than that sometimes.
Okay. Do you feel any sort of neck pain along with this? Any neck
No,
pain, or
no, no,
okay? Do you appreciate any fever, or weakness in your body? Any weakness in your
no,
body? Any
no,
dizziness?
not really.
Any change in your weight?
No,
Okay. Okay. Is there any history, past history related to this? Any history of diabetes, hypertension, or any history related to your joint pain?
no,
And is there any history positive in your family, especially regarding the joint pain?
no.
Okay, Miss Mary, I want to ask some private question regarding your case. Is that okay with you?
Yes, doctor, sure.
Okay. Is there any history of smoking? Do you smoke?
No, doctor.
In the past, have you smoked ever?
No, no,
Okay. Is there any history of alcohol intake?
no.
Okay. Uh, right. And in your family, besides you, what other members are there?
Okay, I'm married, doctor, and I have two kids,
Okay.
and that's it. So we are four people living in the house.
Okay. So you are a housewife, or do you work somewhere else?
No, doctor, I'm a chef. I'm a chef in a
Okay.
very popular restaurant.
Okay. Okay. Good. So in this pain, do you able to work, or is there any hindrance in your workplace you are
Yes,
facing
doctor,
with?
that's the problem. That's the problem, doctor. I am not able to pursue my career in this way. I mean, I cannot cut or cook. This is very difficult
Okay.
for me, and I'm doing it right now, but with great pain. And I'm just afraid that I won't be able to continue my job in this way.
Okay. Do you have any social support?
Yes,
Do you have
doctor, my
enough social
husband is
support
very
for this?
supportive. My husband is quite supportive, and there's friends of mine who are supportive.
Okay.
But it's a painful condition. Nobody can do anything more than just giving me some, painkillers or some just the verbal support. It's really really painful for me right now.
Okay. All right. So, Miss Mary, there will be uh, the best. I will try my best to help you in this regard. Do you have any concerns regarding the case?
Okay, after concerns, how can you deal with the concerns without examination? You cannot, right? So please
Okay, okay,
start examining the
examination.
patient as you have 5 minutes remaining.
Okay, in the examination, I will examine the starting from the complaint area, like in the hand examination, the joint
Okay,
examination.
okay,
Uh,
this is the hand. Okay,
okay, okay. I will
so what will you
observe for
examine in these hands?
initially I will observe for the deformities, then
Okay.
the palpation of the joint and the
Mm-hmm.
fluctuations in the joint, the tunnel sign, Fallon sign
Good,
for any neuropathic process, and
good.
the grip of the patient, the motor activity, and then the reflexes in the upper limb and the proximal power of the patient. Then the other thing, the nail
So,
examination also I
doctor,
will
everything is okay. Dr. Zahir, everything is fine, as you have mentioned. Uh,
mm,
Besides this, that the abnormalities are visible in front of you and there are some swellings and tenderness in the joint. Other than
yes.
this, the Fallon sign is positive as well on the right side. Okay.
Okay, okay,
Motor weakness is not there.
okay. The other thing, then I will do the examination. I will check for the oral ulceration or lymph nodes, and examination of the eye as well, the chest
Mm-hmm.
examination and
Mm-hmm.
abdominal examination. And in the lower limb, I will check for the feet deformities, and any in the gait examination, I will check for the walk of the patient, any deformity, any the back tenderness or any cervical
Okay.
tenderness.
Yes. Good. Okay. So 2.5 minutes remaining, doctor.
Okay,
Nothing else is found on examination.
okay. Uh, okay, Miss Mary, do you have do you want to ask some question? Do you have any concerns regarding the case? I am here to answer that.
Yes, doctor. Doctor, my first concern is I'm very much worried. What am I suffering from?
Okay, Miss Mary, actually, you are a young female with suffering from this joint pain from 3 months. That is actually in your small joint of the hands, and this is the sort of arthritis. From your history and examination, I can appreciate this is one sort of arthritis. In the medical terminology, we called it as the rheumatoid arthritis. Don't be afraid of the terminology. I will try my best to make you understand this. This is the disease in which your defense system against your defense system work against your joint membrane, and it will cause the swelling of the joint, and leads towards the pain and later on the deformity that you are facing with. And uh, this is the situation, and usually affects the young females.
Doctor, is it curable? I mean, can you do something for
Okay.
me?
Yes, the regarding your question, the curable, uh, I can say this is the disease in which the multidisciplinary approach in the by saying the multidisciplinary, I mean that we involve the different sort of teams, like the rehabilitation team, the physiotherapist, and that will give you the modification, the occupational therapist, which will modify your activities. And besides that, some medications, after running some blood tests and confirming the case, the medicines will be prescribed. And for your numbness, as something that is you are facing with the other thing, the numbness in your right hand, with the for that the splints will be given by will be provided with the help of the physiotherapist. And some medications will be given for the relief of the symptoms. And your life can be adjustable with the therapies and medicines.
Okay. Okay, doctor.
Okay, so
Again, ask, do you have any other concern? So,
uh,
doctor,
s-
yes, I was thinking, how can I continue my job?
okay, regarding your job, as you are a chef and you are facing with the problems because of your pain. You must provide it with the support, and you said you have the support from your husband's side. If you need more support, we can provide the social worker support in your case. And the other thing is that with the medicine and with the therapies, occupational therapy will be provided that will help you in adjustment with your job as well.
Okay, doctor, can I take medicines if I conceive because I want to conceive?
Okay, the good thing, if you conceive, in that case, the medications will be given, the medications will be decided according to the according to your case, the medicines that will be safe for you and for your baby in case of conceiving. And the further help from the gynecologist and the senior consultant will be asked regarding this.
Good, good. Okay, okay. So, doctor, are you going to start the medicine or is there somebody else who will start the medicine?
Okay, I
Hmm.
will refer you to the rheumatologist
Joint doctor.
okay, I will refer you to the joint doctor who will guide you in this regard
Okay,
and
okay.
further.
Time is already up, Dr. Zaid. I have
Okay.
extended your time about I think 1 minute more. So
Mm.
that was good. Okay, how will you conclude? How will you say goodbye to the patient? I mean, how will you
Okay.
close your discussion?
Okay, Miss Mary, uh, from your case note and from your history and examination, and by discussing the case with you, I think I tell something to you, but I am here if you have any other concerns, and if
Mhm.
I will be available, and you can come to me and you can contact me, and
Okay,
I will help you in this regard.
okay. Thank you, doctor. Thank you. So first of all, we'll moving towards Viva. Okay, is that okay, Dr. Zahir?
Okay.
Yeah, and then I'll give you the feedback. Okay. So everybody is on the feedback side. Everyone will give feedback about Dr. Zahir, and you know, I think we can take. I've not added the consultation sheet here, but okay. After Viva, I'll guide you how to grade Dr. Zahir about this station. Okay, Dr. Zahir. The first station is briefly summarize your positive findings, doctor.
Okay, 30-year-old female. My patient, Miss Mary, is 30-year-old female who is suffering from the bilateral hand pain for about 3 months, and along with that, patient is also facing the morning stiffness and the difficulty in performance in his job work because of this pain. And besides that, there is no other complaint and other systemic complaint. And in examination, there is the swelling of the small joints of the hand, and there are deformities, the swan neck deformity and the Z deformity of the thumb, and in both of the hands, and their tenal sign is positive in the right hand. And besides that, the other finding, there are no other findings.
Okay, so what are your differential diagnosis, doctor?
Okay, based on the history and examination, um, the first thing that I can consider is the rheumatoid arthritis,
Mm-hmm.
as the patient having the patient is young female with bilateral hand joint pain with morning stiffness and pain in the small joint with the redness and swelling in the joints.
Okay,
The other
and
thing, the other differential, okay, the other differential, the seronegative spondyloarthropathies can be made, but the that is lower down because regarding that there are no other bowel complaints for the IBD related seronegative arthritis, or there is no complaint in the back, the sacro for as regarding the ankylosing spondylitis, or
mm-hmm.
the but, uh, The other thing, the other the differential diagnosis that I can make is the SLE, the systemic lupus erythematosus. But many points are not in favor of that. There are no facial rash or oral ulceration, but the small joint pain, the later on
Okay,
patient can
just
develop
give
that
the
findings.
differentials, right? So you said
Okay, okay.
rheumatoid arthritis, then you said seronegative arthropathies, including
Including the ankylosing spondylitis and
and
IBD
okay,
related,
IBID. Okay.
reactive.
How?
Okay.
Okay, just okay. How will you investigate, doctor? Because you're running out of time. How will you investigate?
Uh, Okay, I will send the RA factor anti-CCP
Mm-hmm.
and the X-ray of the small joints and NCVEMG for the
Nerve
carpal tunnel
conduction
syndrome,
studies for
nerve
ruling out.
conduction.
Okay, okay. How will you manage this patient, doctor?
Okay, the management will be multidisciplinary from the starting from the rehabilitation and general management, the icing of the joint and the physiotherapist and occupational therapist.
Okay.
I will refer the patient to the rheumatologist for the start of the
Okay, just
medicines,
give me
the
the
particular medicine.
names. Just give me the names of team doctors to whom you will concern.
Okay, the rheumatologist,
Okay.
neurologist,
Mm-hmm.
and physiotherapist.
Okay. What investigations would you like to perform before starting long-term treatment?
What
Any specific
investigate?
investigation that you want to rule out before starting long-term treatment? As you know that the case of this is a case
Okay,
of
okay.
rheumatoid arthritis.
Okay.
You are going for
I will
immunosuppression.
try. I want to rule out any history regarding the tuberculosis as
I'm
the
not talking
all.
about history. I'm talking about investigations.
Okay, the chest X-ray
Okay.
and um, interferon gamma release assay for
Anything
ruling
else
out the
for immunosuppression besides, yeah,
hepatitis,
hepatitis what? Which hepatitis?
hepatitis B surface antigen and
B and
anti-HCV,
C and one more thing, one more
HIV,
while, sorry,
HIV.
HI. Great. Okay. Okay, that's great. So time is up. Now everyone will give me the marks regarding the case we have already discussed. And you can give marks according to this sheet. Okay, so there are total 14 marks, is a maximum marks actually that one examiner can give you. So in this station you will be faced by two examiners and the total marks will be 28. But right now, because you are one person, so you'll give marks out of 14. So individual marks should be given and then give me the total marks and comments. So physical examination, if anything is missed, I mean, we cannot see the physical examination of Dr. Zaid, but we can actually visualize whatever she said. Okay. Then identifying the physical signs, clinical communication skills. This is a basic thing that we want to discuss. Differential diagnosis she made. Then judgment about the management, investigations, involvement of the teams. Then how much she was able to manage the patient's concern, and what about the maintaining patient's welfare. Okay, so I'm giving you a minute to score regarding this consultation station in the chat box, please. I would appreciate if everyone will participate in this. Okay, okay, okay. So let me give the feedback. So Dr. Zahi, as it was, I think your case at a very beginner level, you have just started your preparation. but you are very good and you are quite fluent as a beginner. And other than this, you have applied the best of your knowledge, and you have almost answer all the concerns as well. But it can be improved in after getting some polish. Okay, so don't worry about it. It's just a first case. So physical examination, yes, you have done a good thing in physical examination, and I might give you a 1.5 or 2 in this. Then identifying physical signs, in which you can say that, okay, I've seen the patient, and this sort of a thing will be judged on a basis of your summary, right? So this can be improved in a fluent way, in a very presentable way, that this patient has presented with joint pains for last 3 months, and now she's having swan neck deformity in this finger, and some swelling noted, fluctuations noted in this finger. Along with this, there is right-sided Phelan's test positive and all. Okay, so identifying physical sign might be, I will give 1 marks in this. Then communication skills were good, but you need to be more empathic. I mean, whenever the patient is saying that she's in pain, always show empathy after that statement. Yes, I can see that this is a very difficult time for you, or yes, I can see this must be very painful for you, but let me reassure you that I'm here to help you out. Okay, so be relaxed, we are going to help you out. So these are the terminologies or the statements that you need to repeat and repeat and repeat whenever you are seeing that patient is in distress. Okay, so clinical communication skills again. The point is that you have missed few things in the history as well, so it can be improved as well, right? So for the communication skills, I'll give you 1. Then differential diagnosis, yes, you made almost the correct diagnosis except for 1, so I'll give you 1.5. Clinical judgment was okay, I may give you 2. Managing patients' concerns was not on to the point, but was not very disappointing. So it was good. It was average. I'll give you 1. Then maintaining patient welfare, I'll give you 1 because you didn't show much of the empathy. You showed empathy in the beginning and in the end as well, but not in the middle. So you need to show more and more of the empathy. So I can give you 8 or 9 on average. Okay. So it's not a bad score. It's an average score. It's a good score at the beginner level that you have tried and you have made a correct diagnosis actually. So inshallah, in future, with some of the practice, you will be able to get even 14 out of 14 marks in the consultation station. I'm really hopeful for you. Okay, Dr. Zahir, is that okay with you? Anything else you want to ask or you want to share?
Okay, thank you.
Okay, thank you. It was really nice, to have a consultation station with you. So these are the differentials that you can put on, and the closest differential of rheumatoid arthritis is always psoriatic arthritis. And in history, you need to ask about rash. Okay, so I'm just revising the history and the important stuff that was actually the part of that should be the part of the communication. So always greet like hello, good morning, and always try to listen to the patient whenever she or he is saying something. You need to be quiet. You need to be patient. I know sometimes you are out of time, but do not panic. Okay, you need to you need to. If I am going back, then you can see that you need to score full marks in maintaining patient welfare, as we have already discussed in our introductory lectures, that this is the most vulnerable point, because if you do anything bad to this state to this skill, you will lose marks and you will lose whole of the exam. Remember, you have only margin of 4 marks in this, right? So if you damage the patient welfare, if you hurt the patient welfare in any 1 or 2 stations, you are just gone if you have done everything else. Okay, so this is the most vulnerable point. You should score full marks in this, and you can do it. Everyone, if he or she is behaving like a human, he can do it, right? It's not a big deal. It's not a high-fi thing. Okay, always greet like, hello, good morning. This is Dr. Like if I'm doing the history, hello, good morning. This is Dr. Shafi, one of the doctors in the medical unit today. Um, okay, am I speaking to Miss Mary? Stop here. Or Am I speaking to Miss Mary? And are you 30 years old? Stop. Now, now ask, you are asking something to the patient. Listen to her. Yes, doctor, I am Miss Mary, right? Or whatever. Nice to meet you, Miss Mary. Just greet her, right? So that you can make a report. Nice to meet you, Miss Mary. And you can give us, soft smile as well. So it will be shown that you are not panicked, you are very composed, you are professional. So she'll say, okay, nice to meet you, or whatever, or same here. Okay, Miss Mary, I'm here to, set the agenda. I'm here to discuss regarding your health condition and to examine you. Is that okay with you? Okay, then move on. So, from your notes, I gather from your notes that you are having hand pain for last 3 months. Is that correct? Just ask her, is that correct? Or is there anything that you want to add? If she says, okay, yes, I'm having these joint pains. Okay, Miss Mary, can you tell me more about it? Just ask her about that symptom at that point. Can you tell me more about it? She'll tell you, of course, this is an open-ended question. She'll tell you more about it. Just listen to her very patiently and with the expressions of like you are actually listening to her and you are concerned, right? When she stopped, okay, just show empathy. Well, Miss Mary, I can see that this is a difficult time for you, but let me reassure you that I'm here to help you out. Okay? Yeah? Or you can say in a way that, yes, I can see, I can understand that this must be very painful for you. And me and my team is here to help you out. Okay? Now, ask about other symptoms. Do you have any other complaints beside this joint pain? If she says no, okay, let's get back to the joint pain first. Now, ask about the joint pain. Odipera, how did it start? Is it progressive? Is it increasing? Is it worsening? Is it more in the morning or at night, or is it the same whole day? Is there anything else, that you want to tell me regarding this? Or is there anything that makes it worse? Is there anything that makes it better? Right? Are you taking any medicines? Or do not use the word medicine. Are you taking anything, any pills or any injections for this complaint? Right? Then associated features. Do you have any rash anywhere in the body? Any other joint? Is this pain located only to this joint? Or you can ask, as Dr. Zahid did, that can you show me the joints which are involved, or can you show me where exactly the pain is? Right? Is there anywhere else in the body, like your elbows, your neck, or your back, or your feet? Okay. Then, is there any rash? Is there any swelling of the joints? Is there any deformity or change in shape of the joints? Is this pain related with the stiffness in the joints, especially in the morning? Okay, how long the stiffness persists, right? Then other autoimmune features, like is there any history of, or do you have any frequent mouth sores, any sores in the genitalia, or any itching in the eyes, redness in the eyes, right? Any cough? Acha. One more thing, um, you should not use the word of sputum. You should use film. Do you have, if she has cough, then ask about film. Do you get film? Right? It's a substitute of sputum. Then any problem with the bowel and bladder work, any racing and pacing of heart, any tummy pain, right? Any itching in the eyes, any redness in the eyes, and then any tightening of the skin of your hands. Rule out systemic sclerosis. Why not? It. I mean, if it is not generalized one, then it can only involve your hands. Is there any rash? Or I think we have discussed about rash. Then is there any numbness or weakness in the hand or your arms, or difficulty in raising your arms above your head? Do you get any color changes of your fingers, especially in the cold weather? Rule out Raynaud's phenomena. Okay, so you need to rule out these things. And then in general, do you get fever or any change, or have you noticed any change in the body temperature, any change in body weight, or any change in appetite? Then any lumps and bumps in the body. This is really important. Then you can ask about the endocrine issues as well if you want, like thyroid, Do you have any problem in adjusting the in adjusting the temperatures, right? Then, or any racing of pacing of heart or any problem with the bowel works, it will also work in thyroid issues as well. After that, any member in the family is also affected with the same complaints, or is there anyone else in the family having same sort of issues? You can ask in your own style, right? Then any history of surgeries in the past, any history of hospital admissions, any other medical problem that you have in the past. After that, can I ask you some private questions? Then ask about smoking. Do you smoke? Have you ever smoked? Do you take alcohol? Okay. Are you married? Do you have kids? Or are you sexually active? Okay. If you think that sexual history is important, you can ask. For example, if you're thinking about reactive arthritis, you need to ask about the sexual history and then the partners. Okay. Do you have sexual partner right now? Okay. And then ask about more. Okay. Then related to that, about the job, do you do anything for your living, or you are a housewife? Okay, you are a chef. Do not pass any comments, as Dr. Zay, especially to you. Do not give any comments like, okay, that's good. No, no, you're a chef. That's good. No, because you did that, right? So don't do that because it gives, I mean, a weird impression. You are not here to be judgmental or to pass any comments. Okay, it means that if you are passing the comment, you are chef, that's good. It means if she says that I'm a maid somewhere, you will not give that comment, or if she says that I'm a housewife, so you'll not give that comment. So it could be somewhat judgmental. Do not be like that. Okay. After that, do you drive? Because she might be having problem in driving as well. Okay. After that, okay, Miss Mary, do you have enough support available? Do you have social life? Do you have friends? Is your family supportive? How much this disease or these symptoms impacting your activities of daily living and your professional life? Just listen to her. She's in pain. She's telling you that I'm having so much of the problem. Now now show empathy. Yes, I can see that you are in painful situation. It must be very difficult for you, Miss Mary. I realize that, and we are here to help you out. Okay, we are going to run some tests on you, and we are going to examine you so that we can have a better diagnosis and better treatment for you. Okay, so be empathic. Then, of course, about the drugs, are you taking any pills for this condition? If she's taking any pills, she might be. Then again, ask about the side effects of these pills. I mean, I hope that you know that, for example, if she's taking methotrexate, you should ask about fatigability. You should ask about the chest symptoms and all. And in general, you should ask about the infections and fevers, right? After that, you will start the examination. After general physical examination, the hands, elbows. Hands are always been assessed with a pillow below the hands. Then you will examine the patient very gently as she is in the painful condition. You will ask about the pain. You will take the permission that I'm going to touch these joints. I'm going to palpate them. So if they are painful, just let me know. I'll be more careful, and or I can stop. Okay. Then see for the rash. Maybe possible she's not telling you the history of rash, but you should have an idea that where you should look for psoriatic rash. So extensive surfaces should be seen in the arms. Then you should see the scalp line, the eyebrows, the internal ears, the sorry, internal ears, not the external ears, right? Then you can perform prayers and reverse prayer sign in the form of tunnels and felons as well. Then you can check the motor powers like a hand grip, the proximal muscle powers, the cervical movements, neck movements. Examine the eyes and oral cavity, look for thyroid, look for cervical lymph nodes. And along with this, you should, auscultate chest for any signs of fibrosis or any chest infection. And you can ask the examiner that I want to, check for the spleen for Fallot syndrome. So you need to make the position of the patient in a prone patient, and then check for spleen, ask for any tummy pain, and just palpate for liver and spleen, right? Then examine foot and do gait examination as well. Okay, that's a part of neurological screening. You can check one reflex or plantar as well. Okay, then after that, back to the concerns. You come back to the patient. You sit down. You said, okay, Miss Mary, do you have any concerns? So she asks you that what am I suffering from? So you can say that, yes, well, Miss Mary, after your taking your history and doing your detailed examination, I can tell you that um, uh, you are suffering from a disease called rheumatoid arthritis. Please don't be worried about the terminology. I'm going to explain it for you. It's an inflammation or swelling of the layers of the joints or the membranes of the joints, and it's due to the process that involves or that attacks the in that your own defense system will attack your own body cells. So this is a suspected diagnosis, but we need to run some basic tests. We need to do some scans of your body, and after that we can conclude, and we can give you a confirmed diagnosis for that. Okay, now she asked you that, is it curable, or can you do something for me? So you can let her know that, well, Miss Mary, I'm so sorry to tell you that this disease is not curable, but yes, it is manageable, and you can live your life in a good way, in a normal way. If you are on some treatment, we can manage it, and for that, we need to involve multiple doctors from multiple teams, including joint doctors, including the doctor from the including brain doctor, including the pain management doctor, and the physiotherapist, and the doctor we call occupational health physician, to adjust your job issues and to provide you some with some of the alternative options, or can shift your job at your workplace from the point where your manual work is more, to the point where you can supervise, or you can do some sort of stuff that may not need much of your manual work, right? Or they can provide you with some utensils or some um, cutlery that can help you out to continue your job. Okay, so in that way you can address. You don't need to give all the list and everything, but you can give a simple layman statements that can be easily absorbed by the patient and can be understandable. Okay, then can I take medicines if I conceive? So, Miss Mary, I'm going to refer you to the joint doctor, and I'm going to involve my consultant as well. So they will give you a better idea regarding your pills and your medicines that you need to take. And yes, there are some medicines that can be taken if you are planning to conceive. But let me tell you that before conception, you should tell us, and we should have a pre-planned conception in you, so that we can give you some vitamins beforehand, and we can adjust your medicines according to your scenario. Okay, and then after that you can conclude. I hope Miss Mary, or you can say that, Miss Mary, do you have any concerns? You can ask me. She said no. Okay, doctor, I'm good. So you can say, okay, Miss Mary, if you want, if you have time, right, then you can offer that, if you want, I can conclude the session for you, or I can summarize for you. And if she says so, you can summarize in 2 to 3 statements. Then you can say that, okay, Miss Mary, let me reassure you again that me and my team is here to help you out. I hope that I've answered all your concerns, but if you have any concerns else, then you can come back to us. We can arrange another meeting with me or with my consultant. And before leaving, I'm giving you an appointment with the joint doctor. I'm arranging an appointment with the joint doctor, and I'm also providing you some web links, or you can say some brochures, some pamphlets or leaflets, so that you can study more about the disease. And if still you are confused about anything, you can come back to me. I'm here to help you out. Okay. So this is a way to communicate, or this could be more better. I mean, this is just a scheme or a guideline on which you can work on. Okay, I hope you people enjoyed this session. If you have any queries, you can write down in the chat box. I'm giving you a minute. If you have anything to share, you can write down in the chat box. Any feedback, any suggestions, or anything else you want to add, or any queries. Okay, I hope there are no more queries or questions. So we are ending our session here. I'll be waiting for your suggestions or feedbacks, as that will give me motivation to continue these sort of sessions or to continue with the proper course. I hope you must have learned something and you have enjoyed this session. So Allah Hafiz and take care.